Good morning.
Good morning.
If you don't mind beginning by introducing yourself and saying a little bit about your career journey.
Certainly. I'm Marvin O'Quinn, and I've been retired now about almost 2 years. I retired as the president and COO of Common Spirit Health. I worked in the healthcare field, I guess close to 40 plus years. I got my MHA here in 1977 and went on to work for Harborview Medical Center for 5 years. Then I went down to Fresno, California for a couple of years, then into Oregon for over 10 years, working for Providence and Legacy. Then I went out to New York, where I was the chief operating officer at Columbia Presbyterian and worked there doing the merger with New York Hospital. Then I stayed in the Northeast and became the chief operating officer at the Atlantic Health System, which was based in Florham Park, New Jersey. And then I got recruited from there to become the president and CEO of the Jackson Health System in Miami, which is a large public health system similar to Harborview. And I stayed there for 6 years and was recruited to become the chief operating officer at what was then called Catholic Healthcare West, which eventually became Dignity Health, and based out of San Francisco. And worked there for 10 years or so. Then we merged with Catholic Health Initiatives out of Denver, and we became Common Spirit Health, and I was elevated to president and COO of that company, and I retired from there.
Can you say a bit about your earliest experiences, both through the MHA program and your first job right after?
Well, certainly. So while in the MHA program, actually, I'll go back before when I applied to become a member to get into the program. And Bill Dowling was the director at the time, and he liked the work that I had done because I'd been volunteering in hospitals, and I was a pre-med biology degree in undergraduate. But he wanted me to get a little more experience in hospitals, so he said, "Look, why don't you go off and work for a year in a hospital, and then come back and we'll put you into the program," which is what I did. And when I got into the program, I went into the strategic planning track. There were 3 tracks in the program at that time: policy, planning, and operations. And I got into planning, and Scott McStravick was my faculty advisor. And I met a lot of friends there, and in fact, Dennis Stillman, who became a good friend at that point in time. And when I finished the program, I went up into Harborview Medical Center as director of planning. And back then, we had significant of need requirements or rules. I don't know if they still do here or not. And so my first major project there was to write a certificate of need to approve the expansion of the hospital, which is what you see now when you pass by the freeway. I was also the developer of Airlift Northwest, which is the big helicopter program. And actually, that began sort of my journey in operations because no one wanted to run the program. And so I said, well, I'll do it. And so I developed the business plan for it, and then once that was approved, I took over the operations of it and ran that while I was there. I left Harborview, so I was Harborview for 5 years, but it was an interesting environment back then in the early '80s. It still is obviously a highly desirable place to live. But back then, there was really no upward mobility. There was very limited upward mobility possibilities. And so I felt that if my career was going to advance, that I would have to leave the area, which is a very difficult decision to make, particularly since my wife was born and raised in the Seattle area. But she was a real trooper and always has been. And as you know, obviously we moved a lot. So I decided that I would leave the area to look, to get a better job so I could get on a better track for advancement. So my first 5 years at Harborview was basically strategy, program development, did a lot of statistical work, analysis, and that type of work is in my position as director of planning.
Um, Looking back, what were some of the pivotal moments or decisions that shaped your trajectory in healthcare leadership?
Boy, there've been several. I was when I went to Harborview, Mike Rona was my direct supervisor, and we became friends. And he helped me a lot in terms of sort of introducing me to the world of how hospitals work, and what the structures were and how decisions were made, and the involvement of planning and strategy in terms of predicting the future for an organization or driving the future for an organization. And when I left there and went to Oregon, essentially, another big moment for me was working with a guy named Russ Danielson. So I was working as the president of one of Providence's smaller hospitals, and we did a huge reorganization, and they eliminated all the presidential roles, and all the hospital people became COOs of the hospitals. And they divided the company up into basically three divisions. There was the health plan division, there was the physician division, the hospital division, and then there was the patient acquisition division. The patient acquisition division was marketing, and actually marketing and health plans. I can take that back. The health plans, which was an IPA and an HMO. So you had the patient acquisitions, the physician organization, and the hospital organizations. Oh, the fourth division was long-term care. So there were four divisions. And so I learned operations because Russ was very good at what he did. And so through him, I developed a lot of skills and techniques in terms of how to run an organization, how to put the real focus on operational efficiency, but at the same time inspire people to sort of achieve their very best. So he was a great mentor for me there to be able to do that. And from him, I think, in fact, I saw him the other day and I said, a lot of the skills that I learned then, I took with me throughout the rest of my career and still applied them until I retired.
Um, it's interesting to me. You seem to be focusing on the relationships even more than the experiences. Can you say more about the importance of these relationships, mentor relationships, collegial relationships, and how they've influenced your career journey?
Well, if I look at my sort of group of friends, they're all people I've worked with. Because you spend, most of your career, or when you're working, you're spending, I work 10 hours a day. So I'd be in the office at 7 o'clock and I'd leave at 6. And so you spend the majority of your day, with the people who are at work. And over time, you develop relationships and friendships that, become permanent for you. And if you don't enjoy where you work and you don't have relationships there, it's awfully hard to do your best work. In addition to that, you want, at least I always wanted, and I wanted the institutions that I ran, I wanted people to want to come to work, to enjoy being at work, to realize that there was a higher purpose here, that we were driving a purpose that was taking care of people at their most vulnerable moments, and that the work that we did really mattered in the lives of these people. And I used to talk to folks about, I could be working on a bank, I could be working making cars, but we're doing this and we're taking care of people at moments of their lives when it's the most difficult for them. The most, unless they're in a hospital and have a baby, no one wants to come to a hospital. It's usually something wrong has occurred. Something bad has happened, and now you got to respond to that. And so you want to treat people with dignity, and you want to take care of them as best that you can and make them feel like they're valued and that they're human beings. But the only way to do that is if you feel that way about your coworkers. You can't take care of people positively unless you're taking care of yourselves and taking care of your own relationships.
Um, yeah, I think it's important for our students to think more about the relationships that they will develop in their early careers. And I know in mine, we've talked about some of our common mentors. It's not so much the experiences that I've had, but the relationships that have developed as a result of them that have charted my career. Yeah, and I hear that in yours as well.
No, it's very important. I mean, well, I was in San Francisco 3 nights ago for a dinner of the executive team from Dignity Health. I mean, we worked together for 10 years before the merger. We all know each other's families. We've gone on extended trips together, work trips, and with our families were there. And so those bonds and relationships that we built, well, they'll be with us for the rest of our lives.
Um, so to touch back on something you mentioned earlier, I'm curious about what inspired you to pursue a career in healthcare management rather than in another field within healthcare.
Well, when, you got to remember, this is, I was in high school in the 60s. So it's an entirely different era from today. And back then, if you were African American and you're a kid, your parents pushed you in certain directions. So, they want you to be a doctor, they want you to work for the post office, they want you to be in something that they view as sort of constructive, engineering with things, something like that. But so I went to UCLA as an undergrad as a pre-med student. And many of my friends were also pre-med students or pre-dental students. And back then, you could get into med school before you finished your undergraduate degree. And so a lot of my friends, they left after their sophomore or junior years. And I'm still sort of working my way through because in my heart, I did not want to be a doctor. I was pre-med, I had a molecular biology undergraduate degree. And I was, to be candid, struggling. I mean, organic chemistry almost killed me. It was just hard, and because I just didn't have the mentality for it, and I certainly didn't have the money to go to medical school. And so when I actually graduated, after I had transferred up to UW, the idea was, okay, what am I going to do? Do I want to go to medical school? Not really. I hadn't even applied. And so I'm thinking about, what my options are, but I knew I liked health. I had been working in hospitals as an undergraduate when I was in between my freshman and sophomore years at UCLA. I was an orderly at big county hospital. And that was really my first exposure. So I knew that I wanted to do something that would contribute to helping people in their lives, but I didn't want to be directly on the medical front. And so I looked into pharmacy schools, and a friend of mine told me I should look into hospital administration. And so I did, and I thought, well, this makes sense for me. It kind of felt like it resonated with me in terms of what I thought I could do and could be successful at doing. And so I applied here. I applied at a number of other schools, and I got accepted at all of them. But I wanted to stay here, and I liked the program here, and so that's sort of how I got in.
So I want to ask you a bit about your experience while you were here.
Well, you do realize that was almost 40 years ago.
Yeah, campus is a little different.
It's very different. Yeah.
Something the program is still going strong.
Yeah.
In our second half century now.
Yeah.
So what originally drew you to this MHA program?
Well, as an undergrad here, I was able to get to go over and physically visit the space, whereas the other schools I applied to couldn't do that. And I met Bill Dowling. I liked him. He seemed to like me, and I got the feeling from him that he would, look out for me. If I could say that he cared about the students and he would care about my achievements and would help me to succeed. I grew up in the inner city. I didn't get the greatest, under high school education. I didn't have the greatest grades as an undergraduate, but I did much better as a graduate. And part of it was the nature of the program and how they worked with me and helped me develop study habits, hooked me up with other people in the program that, who maybe had better advantages than I had that I could learn from. And all of that really made it, possible for me to have the achievements that I've had in my career.
Um, so how did your time here at the UW prepare you for the complexities of leading large healthcare organizations?
Well, that's an interesting question because, when you're in school, it's an academic environment. And what happens inside these institutions can be completely different. And so we had, and we talked about this earlier with Austin Ross, who was running Virginia Mason at the time and also teaching in the program. So he gave us some exposure. And we had John Tiscornia, who was working for Arthur Andersen at the time, and he'd also taught in the program in finance. And so we got some exposure to what it's like in the real world, if you will. And I hate to use that word because both worlds are real. They're just different. Organizations have hierarchies and political structures, and they have personalities, and there's a bunch of personalities in those organizations, and that you have to be able to relate to and deal with if you're going to be successful. So I think what the program did for me was gave me a foundation to build on that was solid. Now, in order to succeed, the rest was up to me to figure out how to use that foundation to drive my career forward. But the other part of that foundation is confidence, in the sense that you know what you're doing, you believe that you can be successful, and you're willing to take risks, which all came from the 2 years I spent here, giving me the right kinds of skills, investigative skills, because you learn one set of data here, but out there is this whole different types of data, and lots of it. There's lots of data that comes from all over the place. And so I left the program feeling good about myself. Honestly, I hadn't thought about this to this very moment. When I finished the program, I probably felt as good about myself as a person in terms of my ability to be successful in this world as I ever had. You're growing up as a young Black male in the inner city of Los Angeles, you're not exactly filled with people telling you you can do things, people pushing you. They're usually pulling you back, they're pulling you down, everything's oppressive. And so for me to get into the program and then to finish it, when I left, I felt pretty good about myself, that I had achieved something that no one else in my family had achieved, none of my friends had achieved. And so I felt like, I can make it in this world because I have the skill set and I have the basis to be able to do it.
Um, one of the reasons that I stay in academia is I have similarly benefited from this generational transformation that happens when someone is given access to a degree or to a graduate degree. If you don't mind, could you share a little bit more about what the academic accomplishment, what earning that graduate degree meant for you and meant for your family? How did that experience, apart from your distinguished career, like how did that change you?
Well, I think I'll start off by saying that my degree enabled me. I've been all over the world. That would not have been possible without that degree. I built a hospital in China. We negotiated contracts in the Middle East to buy equity in hospitals. Would not have been able to do all of that stuff if I hadn't had a degree in the academic background that I had. I am, secure, and my family is secure, and my family is secure for generations because of what I've been able to do, which would not have been possible if I hadn't had the academic background that I had. Coming from where I came from, education, the high school that I went to, John C. Fremont, a good school, but we weren't competitive academically. I was on the chess team, on chess club in high school. I was also on the basketball team, so I got to balance that out. And we played chess at Beverly Hills High, and we played chess at Palos Verdes Estates. You walk into those schools, and the resources that those kids had, was just another world, way beyond anything that we had. We were still using old books at our high school. And so, many of the people who I grew up with, were in gangs, or they went to work for the post office, or they went into the military. There's nothing wrong with that. I'm not saying that in a disparaging way. I'm just saying that, what was open to us was very narrow because of who we were and where we grew up. And the fact that I was able to get through that needle, if you will, it started with a high school teacher who saw something in me, and she got me into the UCLA summer program, where I did my summer before senior year, and that gave me almost automatic access into UCLA. And that's how I got into UCLA, instead of, say, Cal State Dominguez or Cal State LA or someplace like that. And there, I was exposed to a whole new world. First of all, not to get racial, but most of the people there were white, I came from a world where 95% of the people were black. And so now I'm exposed to just a whole new world, if you will, which, in my viewpoint, you can either recoil from it or you can embrace it. So I embraced it. And I'm around people who have ambitions, right? And I'm around other black students who have ambitions. They want to be dentists, they want to be doctors, they want to make changes in the world. These were all things that were new to me. And so it's sort of, I guess there was always something inside of me that, if you will, that had this desire, and it just needed to be opened up and be able to see other people who do these things to say, yeah, I can do this as well. And so from there, I got into the graduate program. So at this level now, everybody is very smart. Everybody has a viewpoint and goals in terms of what they want to do with their lives. And so if you don't develop those things, you're kind of like the odd man out. And so I started thinking about, okay, what's the next step for me? What do I want to do with this career? What do I want to do with this, with what I'm learning here? And that sort of drove me. It developed this drive to say, okay, I want to run a large organization. So what do I got to do that? The degree opens the door, gives me the skills and the capabilities and the basic understanding, but there's so much more out there that I'm going to have to learn in order to be able to do that.
To build on that, can I ask, are there any specific courses, any specific things that you learn, any experiences you had or faculty that you had during your MHA that you drew on during your career in building large organizations?
Well, Austin Ross, Steve Shortell, Cindy Watts, Scott McStravick, who I know has passed away, and Bill Dowling were sort of the key folks in my life in the program. And those folks really gave me some insight into what I could expect and helped me sort of develop myself and develop my skills and gave me the confidence that I needed in order to be successful.
Are there any subjects that you continue to draw on? Any courses that you thought back on during your career journey?
So we had a it was, what would we call it? Scott McStravick ran it. It was only like 10 students in it. It was a case study model program that he used to do. And it was all about market development and strategy. And I've forgotten the project we were working on, but the whole, that sort of formed the basis of my thinking around strategy and strategic advancement for an organization. And I've carried that with me throughout most of my career. I would also say that I know that people look at organizations and say, well, there's operations over here and there's strategy over there and there's whatever, finances over here. The reality is these things are not that distinct. They are integrated. And I believe that because I had a strategic background and have been trained in that in the program, actually made me a better operator. And so and strategy is about thinking about the future and building programs about the future. It's also about leadership. It's about vision, goal setting, and galvanizing people to look forward for the organization. And so I was able to take that into my operational roles and really drive the organization forward, not just based on FTEs per occupied bed or all of these sort of productivity measures that operators live by, but about what programs are we developing? What does this population need, and and how do we provide it? How do we compete against our neighbors? What's our market share, both in the ambulatory setting and in the inpatient setting? Things that operators don't normally think about, I thought about, and therefore the operators who work for me began to think about it.
So if we can build on that a little bit and talk specifically about management education and the value of management education. In your opinion, what makes management education, and specifically in MHA, valuable in today's healthcare landscape?
Well, hospitals are not like other businesses. On the one hand, you're taking care of very vulnerable people. On the other hand, you're providing a service today and you might get paid for it 3 months from now. And so your understanding of the finances of how to run the hospital, what are the key measures that you're using to understand as success or not success in the hospital are different than, say, running other types of businesses. And so I believe that the MHA degree prepares you uniquely for that environment that you're going into. So it's both a business, but it's also a social service. And it's a social service that many times are taking care of people who aren't going to be able to pay you, or taking care of people who are on an insurance plan that's going to underpay you. And you've got to understand how to develop programs that are going to allow you to serve those populations and still be financially sufficient, or solvent, if you will. In addition to that, God, give you some examples from our days at Dignity Health. We developed a program at Dignity Health around people, what's the term I'm looking for, who are being trafficked. And we taught all our emergency room physicians and emergency room staff across 35 hospitals how to try to look for and determine signs of someone who's being trafficked. We didn't get paid for that, but you're a member of this community, and a part of. And I'll say without equivocation, one of the proudest moments of my career was when my director of nursing presented that program to the board, and they applauded her for the work we were doing. And we were actually able to bring in people who had been trafficked and we had gotten them out, and who had gone on to have, get successful careers elsewhere. That's all a part of being a part of, running a hospital. When we went through the pandemic, I told my hospital presidents, look, you have to be a leader, not just inside the hospital, but a leader in your community. Most of our hospitals, and most of all hospitals, frankly, are in residential communities. They're surrounded by homes. And so you have to not just be inside the hospital, driving productivity or building new programs. Your job is to serve the community. And the community has more needs than just their healthcare needs. And there's lots of people who come into our emergency rooms who, if you don't get them some type of program outside of the emergency room, they're going to be back. And they're going to be back again and again because they're not getting their social needs met. So we're a business, yes, and you got to be up on your productivity. You've got to have the right capital plans and spending plans in place, but you're also a social service organization. And I feel like the MHA program gives you that perspective, whereas other degree programs don't.
What do you think distinguishes an MHA from an MBA or an MPH for someone who's interested in healthcare leadership?
Well, I think that the major difference between sort of the business, the MBA and the MHA, is that the MBA doesn't give you that perspective about the social part of the work that a hospital does. So, you're going to get, well-schooled in financial analysis and marketing and, queuing theory and all the things that you need sort of run operationally. But you may not necessarily get this focus on the social side of the business. And you're also not going to get this viewpoint that a hospital is like a living organism, it's an ecosystem. All these departments depend upon each other in order to do their best work. As far as an MPH is concerned, as we get more into disease management and even in population health management, I think the MPH program brings a characteristic that you don't get in the MHA program, which is the statistical analysis and the epidemiology part of the world that I didn't get. And frankly, I never really would have used that. I had people who did that for me. But I think but if you're running a hospital or running a healthcare system, the MHA degree is more suited in terms of its broad perspective of that, as opposed to an MHA program or a degree in just a straight line public health. In my opinion, I'm sure I've offended someone. Hopefully not, but
I had a professor at Berkeley in the business school who used to describe the difference. When you're in the private sector, your job as a leader is to do well.
Yeah.
And you're doing well for other people. And sometimes you can do well by doing good.
Yeah.
But your job is to
do well. Yeah.
And on this side, your job is to do good. And ideally, you can still do well while doing good.
Yeah.
But the doing good is prior.
That's a great way to look at it. Your job is to do good. Yeah.
So relatedly.
Yeah.
How has the role of healthcare administrators evolved since you began your career? And how should graduate education in programs like ours adapt to prepare future leaders?
Interesting. Well, let's just start off with the titles. When I finished, the titling was assistant administrator, actually director. I was director of planning, assistant administrator, associate administrator, administrator. And that carries a completely sort of different connotation. It's what would you call it? Someone like a school superintendent. You're administering something that's not changing. You're just keeping it in place and making it run. We didn't have to promote our programs when I came out. Patients were there. You just had to maintain reasonable costs. And I used to say, make sure there's enough cookies in the surgical lounge for the surgeons and everything's going to be great. Well, that's not the case anymore. So in today's world, the leader of the hospital is president and CEO. The operating person is not the associate administrator. He or she is the chief operating officer. And so the executives are typically referred to, as the corporate suite. So it's much more corporate orientation. C-suite is what, and so you have all these people that are chief of something, chief people officer, chief financial officer, chief operations officer, chief nursing officer. So it's a much more corporate business orientation than when I came out of school. And this is true whether you're in a, like Common Spirit Health, which was, we're in 21 states, et cetera, or you're at, a local 250-bed hospital. It's still the president, it's still the COO, it's still the chief strategy officer. So the whole sort of milieu of titling and responsibilities to go with that titling has changed since I was in graduate school, and it changed probably after about 10 to 15 years in the business. And a lot of this came from the outside of influences where if you look back, and I did a study on this because I made a presentation on it once, every single president going back to Nixon tried to do something with healthcare. And because the idea was, well, it's taking up too much of the gross national product. It's growing too big, and the costs are too high, and therefore we need to intervene some way. And I think it was President Reagan who sort of tried to introduce the world of competition into the healthcare environment. And I think that's about the time, I could be wrong with my thinking right now, but that's about the time all the titling changed, because the idea was these institutions, because we're a capitalistic society, competition is good, it's going to create higher quality, and it's going to create lower costs. And if we put that into the healthcare system, then that's the outcomes we got in other industries, we're going to get it in healthcare. And so the idea became no longer are we sort of administering and acting as a public good, we're now businesses. And as a business, you need people who have an understanding of growth and driving your organization forward. And so all this titling changing and all of that became really the substitute or the signal that the way we do business is changing. And they changed how they reimbursed under Medicare to a DRG structure. The insurance companies got more aggressive in terms of rates and how they were negotiating rates. And so the people who were in the business in the time and the people who are going to come into the business now have to understand that they're coming into a world where competition is a driving factor. And so in order to be successful, you need to understand market share, market analysis, growth, capital deployment, and of course, how to drive and really galvanize your people.
Excellent. So I want to shift gears a little bit and ask you to offer some career insight and some advice to our graduates. So what skills or qualities do you think are most essential for emerging healthcare leaders today?
Well, I believe in general, what has served me well is the willingness to take on any project. And so I just said, if there's something out there, I'll do it. And it didn't matter to me if I knew what it was or not. When I developed Airlift Northwest, I still remember the meeting when I think it was either Mike Rona or Bob Jetlin, who was the CEO, talked about this program, wanted to know if anybody knew anything about it. And I raised my hand and said I did. No, actually, I didn't. But I raised my hand and said I did. And they said, okay, well, you go out and do some work on it and come back with a presentation on it, which I did. And as a result of that, I got to run the thing. When I was working in Oregon at a hospital, we were developing outside the hospital home health programs and respite programs. No one else wanted to run them. I raised my hand and said that I would. And so I believe that particularly when you're coming, because the industry is different now. When I came out of grad school, almost everyone went into either a director's position or VP position. That's no longer true. And so when you come into these sort of lower level management positions and you want to expand, you have to be willing to take on projects that maybe you don't know anything about. You have to make yourself indispensable to the management group there. So I think that's important. The other thing is, and this is a decision that becomes a difficult one. Are you willing to move to advance your career? Now, if you look at my resume, I've lived in a lot of cities. I don't believe that I would have gotten to where I got to in my career if I had stayed just here in Seattle. Although I might have had a better life. I mean, Seattle is a wonderful place, but there's a price to be paid for moving. You don't have any roots anywhere, and that's the price. But I was willing to pay that price, and my spouse was willing to pay that price. And as a result, I was able to advance my career probably more rapidly than I would have been able to, because I was moving to bigger and bigger jobs. They just happened to be in different parts of the country. So every student has to make that decision. Are you willing to do that? And then the last thing I would say is, and we're in a building that's entitled Population Health. Running, you have to think about, you're not running a hospital anymore. There are jobs inside the hospital, yes, but if you want to advance to the top of these systems, your viewpoint has to be, I'm running an organized delivery system that has a hospital, it has a physician group, it has a whole host of outpatient capabilities, and you need to understand the mechanisms of how all of these things run and how they integrate together to create a service for the community. So the idea is to capture patients early and have everything within your system that they need so that they never have to leave the system again. And so I think they need to understand, long-term care, ambulatory care, emergency rooms, and of course the overall hospital as well, and how to piece all these things together to make them run as a system.
So how can MHA students and early career professionals best position themselves to become indispensable or for success in what's become a really rapidly changing industry?
That is, that's an interesting question. And I think that, well, as I said earlier, offering the willingness to take on any host of projects, getting a variation of exposure within the system. And so, we have internships at certainly not Dignity, but at Common Spirit Health. And there's but we rotated people through all aspects of the system. So you want to be able to get exposed to the hospital side, the physician network, if they have a healthcare plan, the healthcare side, or the health plan side, to give you a broader perspective on what the whole healthcare delivery system is about. And relating back to a question that you asked me earlier, and I talked about what happened at Providence in Portland, that was important in my career because John Lee, who ran that division, even though I was working at one of the hospitals, he took all of his executives and he sprinkled us on various boards throughout the system. So I was on the health plan board, and I was also on the physician division board. And so it gets you out of your sort of singular box of just being the hospital guy, and it gave me a viewpoint of other parts of the system and how they worked, and the importance that they had to the overall system. And I think as new executives come in, you've got to have a much broader viewpoint than I had back in 1979, because these systems, most of the single hospitals are gone. It's all about large systems now, and large systems have a whole host of different programs in which you can, make your career.
What's one piece of advice you wish you had received at the start of your career?
One piece of advice. I don't. That's interesting. What would have helped me better? I'm trying to think. I mean, I've had. I'm not sure. Uh, I think it would have helped me um, if I had thought a little before the first job that I took right out of graduate school, well, not right out of Harborview. You know, you know, I went to a community where we didn't stay there very long because it was so different from Seattle. I mean, Fresno, you can't get, I think you have to be, I should have been a little more selective about where I went. Now, things worked out in the long run, but I paid a price for that, and my marriage paid a price for that. And so I think that, coming out, you wanna take jobs they're going to help you. I know I'm rambling a little bit. I'm trying to think about what's the right answer here. I think that if you have your goal set for where you want to go, then only take jobs that are going to help you get there instead of just taking jobs because it's an advance one way or the other. And the Fresno job was not going to take me. I just took it because it had a bigger title and a little bit more money, and that and I paid a price for that. So I think if you think about what it is as you're coming out of grad school. What is your real goal? Do you want to be a president of a system? Do you want to do you want to be a chief operator? What do you want to do? And then look for jobs that are going to get you on that trajectory.
Is there a piece of advice you got along the way that you reflect back on?
Uh, yeah. Um, the president of Providence told me once, he says, you need to stay, because I was trying to advance quickly within Providence. I was always very anxious to climb up a ladder. He said you need to stay at a place long enough to live with your own bad decisions. And I always remember that because you're going to make them and you can learn from them if you're there to experience them.
Very true. So looking ahead, what excites you most about the future of healthcare, and what challenges do you see for that next generation of leaders?
Well, we're going through a very difficult time right now, as we discussed, with the potential cuts in Medicaid. We're not sure what they're going to do with Medicare. The commercial insurance companies are getting very aggressive about rate negotiations, staffing shortages, rising salaries. I mean, the challenges are real. I mean, the headwinds, as I refer to them, are very strong. But for me, I've always looked at that as tremendous opportunity. It's an opportunity to change. It's an opportunity to do new things, an opportunity to innovate. And so as you're coming to, the industry right now, the industry is in somewhat of turmoil. Many of the big systems have still not recovered from the pandemic. Many of them are still funding their payrolls off of their balance sheets. And so the opportunity, because hospitals, I will say, as great as they are, they don't like to change. People still do things the way they did them 30 years ago. And so given the challenges that are out there right now, innovation is the only way they're going to survive. We talked about AI earlier. It's technology, advancements in technology, innovation in technology is what's going to help hospitals really meet the future. And the other point, and we've talked about this a lot, and it's hard to think about community health and network development and integration of systems when you're bleeding red ink. But the only way to stop bleeding red ink is to really go towards this whole management of health perspective, as opposed to just running the hospital. If you can get paid for keeping people healthy, it changes your financial model, and it's a much more sustainable way to work than how we're working right now. Many institutions were on that journey, and unfortunately, the pandemic, I think, set us back a little bit because people really got into survival mode.
Um, so, with that set of challenges that we're likely to experience in healthcare for at least the near future, but likely a little bit longer, how can MHA programs like the University of Washington continue to stay relevant and impactful in preparing leaders for tomorrow's healthcare systems?
So, in addition to just the basics, which always have to remain there, in terms of understanding the system, how systems work, and how to run and manage, positively strong organizations, you have to start thinking about what are the technological, in my viewpoint, what are the technological components out there the hospitals have not taken advantage of that they will need to bring in order to run their organizations more efficiently. And because of the staffing shortages and all of those kind of things, to me, it's about innovation. And it's about innovation specifically in technology to run your organizations. A good example, I mentioned this earlier, and I found this out about a year before I retired. One of the, and I won't mention the brand, but one of the companies that builds MRIs and CT scanners, they have developed a technology whereas one tech in a remote location can run up to, I think, 4 CT scanners. All right. That's the type of stuff you're going to have to be able to do because CT techs are really hard to find. And so you've got to be open to doing that type of thing. And that's the type of innovation I think that our new folks coming into the industry have to bring with them. Because I also think that the sort of younger generation, which so I'm aging myself, is that they're exposed to technological advances and developments that folks like myself in the field have not been exposed to. They're living a life based on this kind of stuff. And they got to bring that with them into the job because the job needs it.
How can, with those challenges in mind, are there things that we should be teaching our students? Are there capacities in leadership that should be part of curricula like ours that will prepare students for the sort of agility that is certainly required to manage changes today, but that will be required to manage the changes we can't even think of that will pop up in the 30 plus years of their careers?
Well, I would say that, and I don't know whether you have this course or not, so you might, but I believe that a specific course on leadership is required, or would be a good thing. I remember when I was in grad school here and I had to take a course in the business school, and then we had, like, in that course, there was one section on leadership. And the definitions of power within the organization and how you get it and how you use that type of thing. I believe that more of that is needed. And going back to an earlier question you asked me, I think that would have helped me more if I had had more of an understanding. So this is something I've sort of learned over the years about, the definitions of power and how it works, how to be a leader, how to galvanize people. Those are skills that, if we're taught earlier in our careers, would be very helpful.
So now Just to close, I want to ask for a few personal reflections.
Sure.
And the first is, what's been the most rewarding aspect of your leadership journey?
The most we, well, I I think it goes back to something we talked about earlier. It's the relationships I've developed, and the things that we've been able to do together as a team. That feels really good to look back and say, and to look at the successes that we had. And I know that I didn't do these things by myself. And as I look back over the people who have worked for me, um, there's a lot of folks who've had really good careers who got their start working for me. So I feel like, and I've always felt like part of my job was to recruit and develop leaders. And there's a lot of, a fair number of people out there that have worked for me because I've been in the field a long time. And so I feel good about the fact that there are a number of CEOs out there and division leaders who got their start working for me.
What do they say? If you want to go fast, go alone. If you want to go far, go
Go
together.
go together.
Yeah, the relationships have been the most impactful part of my career too.
Sure.
Yeah, and the overlap in our mentorship network, I think, is pretty telling because I'm really lucky, to consider Bill Dowling a mentor now, and Mike Rona, and there's something really special about this place specifically that has kept in its orbit the MHA program so many people who are so invested in the careers and the success of other people. Yeah. Yeah. I think that's the easily the most remarkable thing about this place to me.
Yeah.
And I've spent my career at other MHA programs and other universities, and the magic that exists here does not exist in other places. Yeah. If you could give one message to our current or prospective MHA students, what would it be?
I would say that healthcare is it's a tremendous place to work. I have enjoyed it immensely. And I've been able to get up every morning recognizing that I'm doing something that's making a difference in somebody else's life. And it can be financially rewarding because, there's plenty of opportunity, but it's spiritually rewarding. It's just a great place to work. And there's so many aspects to it, from the for-profit side, and a lot of these startup companies are doing collaborative care and AI and all that kind of stuff, to the traditional nonprofit side in the big. So you don't just have to be in a hospital or in a clinic. There's businesses like Concert Health or Belong Health, which takes care of the Medi population. There's just tremendous opportunities. You can do your whole career here, and you can grow and advance. It's really just up to you. It's up to what you want to do, because the opportunities are there for you to do well financially, and for you to do well by your community.
My family came to America so my dad could go to Berkeley. And while he was at Berkeley, he was a busboy at a restaurant called the Franciscan on Fisherman's Wharf.
Oh, okay, yeah.
And my earliest memories of universities were these trips to Berkeley. And what a magical place. But my earliest memories of cities, when I was very young, my dad would take me out to see the Franciscan. And at that point, my parents were still struggling, but certainly doing a lot better. And my dad would load me up with money to give to the folks who were out on Fisherman's Wharf. And when you're young, certainly you idolize your parents, but you also just accept that the things that they're doing are the things that you're supposed to do.
Right. Right.
And I I can't separate those two memories from my childhood, right? That being at universities and that academia is this really amazing experience that not everybody gets, right? Um, but the more people who can experience it, the better. But you can't decouple that from giving back.
Yeah.
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 Because there are always people who have less and need more.
Always.
Yeah.
Yeah.
That's what I think makes healthcare so rewarding.
It is.
Yeah.
It is.
Yeah.
Now, I'll finish a story that affected me early in my career out. And the one positive thing that came out of working in Fresno is I was within the administrator's office one day, and a woman walks in with a bouquet of flowers and a bunch of candy and biscuits and stuff for the staff. And so I asked the chief nursing officer, I said, well, because they all seem to know her. I said, well, what happened here? I mean, why is she doing this? And she said, well, her daughter was here in the hospital. So my automatic assumption was we treated her and that she had, survived and gone on to do well. And I said, oh, well, we must have did a really good job for her daughter. She said, well, her daughter died in the hospital. And I said, what? And I said, well, why is she so positive towards us? And she said, it's because of the way that she died and the fact that we took care of her in a way that allowed the parents and the family, dignity and care and to feel like, we really cared about them. And she died in as positive a light as you can die, in a positive light as a young child. And I never forgot that. It's the people we take care of are in need for 95% of the time. Regardless of the level of severity, you're in the hospital. And I've got 3 kids and 5 grandkids, and my wife has had major back surgery, so I've experienced it myself on 2 occasions, because my wife also got septic at one point, ended up at UCSF, and I thought I was going to lose her. And the work that those people did to save her life, I will never forget. And I'll never forget. And they treated me very well. And they didn't know who I was. I never tell people who I am. And so, I just can't stress enough that, this is a noble field. It's a noble enterprise.
One of my early mentors, when I was at UCLA, used to talk about healthcare, in that it's just one experience that everyone will have at some point in their life. But for them, it may very well be the worst day of their life.
Exactly. Exactly.
And you owe it to them to try to make that experience better.
Exactly. I agree with that 100%. 100%.